to SJOG's PACE PBS approach. Positive behaviour support is a person-centred framework using the science behind applied behaviour analysis and person-centred values to provide the right support for a person and their circle of support. This will help the person lead a meaningful life. This includes skills building, not simply about getting rid of problematic behaviour. The main outcome from PBS is to improve the person's quality of life. PBS support plans are built up in stages, giving colleagues different strategies to support the person. These are proactive and reactive strategies. They may also be restrictive and non-restrictive. For a small number of people, restrictive physical intervention is required. SJOG have written their own framework and training package, which has been accredited with the Restraint Reduction Network and British Institute for Learning Disabilities. This is called PACE training, which stands for Positive Approaches to Capable Environments. The Restraint Reduction Network and BUILD, British Institute for Learning Disabilities, is the only accredited training that can deliver for physical intervention. SJOG is one of 126 organisations who offer their own training. There are 30 NHS trusts, and SJOG is only one of 20 care providers who offer their own training. What we've done in SJOG, which makes us slightly different, is we have written a framework regarding that. So we have the PACE framework, we have PACE training for all colleagues in complex care, which is a 2-day training course. We offer personal safety training for MDST colleagues. We run an Aspiring Leaders programmes. To date, we've run 2 of these. We have Coaches in Services, which is a 5-day training programme linked to all PACE techniques. In November, we're running instructors training, which is for PACE instructors training. And we hold monthly meetings and best interest meetings prior to any physical intervention being offered. What's the investment for SJOG? Actually quite significant. So we have a consultant working with us alongside us at this moment in time, which was a 2-year programme. We've trained to date 125 colleagues in complex care services. We've had 260 days of training, including bespoke sessions. We've offered 2,080 hours of PACE training, 280 hours of coaches training. Instructors, which will happen in November, is 960 hours of training, and the Aspiring Leaders programme is 196 hours. So the cost to SJOG each year is just over £250,000. Does this make us exceptional? I think it does. We're one of only a few providers who offer bespoke physical intervention training for people supported. We hold monthly restraint reduction reviews to ensure there is no excessive physical intervention. We report annually on restraints used, and we also facilitate robust best interest processes that challenge any physical intervention.
Hi everyone, this is just a quick LMS update and to let you know that the LMS is still very much in the pipeline and being developed. It's going to be fantastic. It's going to offer so much more features and options in terms of being able to select your own learning, be able to track and monitor learning much better. And then whenever we start to really build it out even further, it's going to have so much more space for growing competencies and so many other things. So just letting you all know it's still happening. There's been a few things that have sort of affected the timeline, but you will see more information coming very soon about expected timelines and dates for the full launch.
This study has been conducted by the SJOG research team, and it aims to explore the experience of accessing medical support for people subject to modern-day slavery and trafficking. The research has been part of a series of projects commissioned by the UK Health Security Agency and the UCLH Inclusion Health Outreach Team. People who experience modern-day slavery face several key barriers when accessing health services, such as lack of documentation, language barriers, lack of knowledge of services, or concerns about their traffickers, police, and/or the immigration status. The study was conducted between February and April 2024. In total, 3 focus groups and 4 one-to-one interviews were held, both with people who have experienced modern-day slavery and with project workers who provide direct support to this group in SJOG services. Little is known about the experience of people subject to modern-day slavery when accessing healthcare services. This research aimed to understand how the engagement in health treatment and care can be improved. A recovery period of minimum 9 months is required to address the most immediate needs. This includes safety, stable accommodation, gaining language and life skills, receiving person-centered support, and addressing physical and mental health conditions. Discussions revealed that physical and mental health represent the main needs to address in the wider recovery process. In total, 8 out of 12 participants with lived experience reported being under treatment or receiving therapy. Registration with a new GP when moving from a location to another, attending online appointments, facing cancellations, or not accessing health provision in timely manner all contribute in creating a medium of mistrust in the healthcare system. Feelings of mistrust emerge during interviews. This translates in the perception that the system is broken, that nobody cares about them, or they are not in control of their lives. Reducing waiting times would be the most important for improving access to medical support. Fast diagnosis and consistency of support may also help access the wider recovery services needed for each person. One suggestion focuses on the creation of an outreach healthcare that feels part of the integrated system. In fact, navigating the medical system is not always easy. As one participant suggested, time to listen, to provide direction and information may be the first simple step in addressing this challenge. To make the research of practical benefit, a series of recommendations have been made for improving access to healthcare. These include ensuring continuity of care, improving prevention and testing, collaborating with peer workers, providing outreach healthcare, and raising awareness through policy. The study provides the foundation for key themes that underpin barriers to health treatment, along with recommendations to address this. We would like to thank all participants who contributed to the research with their shared experiences and suggestions.